Welcome. I'm your host, Dr. Frank Sabatino, and today I'm very excited to have as my guest Dr. Mark Huberman, the president of the National Health Association, Wanda Huberman, the executive director of the National Health Association, Dr. Alan Goldhamer, the founder and director of one of the truly iconic health and lifestyle centers that has focused on water-only fasting for decades. It's at the leading vanguard of fasting research in the world and involved with the only place training licensed physicians to do supervised fasting, and Dr. Lisa Acocella, who is really involved in the educational initiative of one of the major programs that we're going to talk about today. So welcome, everybody. It's good to see everybody.
Thank you, Frank.
You know, as we segue into the programs themselves, I just want to make a comment because I think we need to highlight something about the association itself. You know, in the last 20 years, we've had this heyday of lifestyle medicine that has kind of escalated, and everybody gets really happy and excited about all that. But before lifestyle medicine, we know that there was natural hygiene, and natural hygiene was the first place that was addressing these healthful living parameters, including the remarkable benefits of water. When I look at it, I find it really remarkable that the organization was founded in 1948, before there were even color television sets in this country. And 77 years later, through all of the events and economic and political upheavals and technologies that have evolved with AI, here we are 77 years later, and it's still going strong, maybe stronger than ever. So I'd like, Mark, to you, when you think about businesses and organizations, they come and go so much. What do you feel is the foundation for why this has thrived through this period of time? It's just a remarkable thing to me.
Because I think that we were on to something very early on in 1948 and then through the 50s, when we were the only people really talking about what they call today lifestyle medicine. We had concepts that still ring true today, that health results from healthful living. Healthcare is self-care, living in harmony with nature. These were all fundamental principles of the NHA that I know that inspired you, that inspired Alan, inspired Lisa to become involved in the NHA over the decades. There are so many more. But Shelton used to say, let us have the truth though the heavens fall. We've had that truth from the beginning. And even as kind of a student of natural hygiene, these principles were even in the 17, 18, 1900s that, were bits and pieces of these concepts that we kind of all brought together in the NHA. But again, I like to say often that a lot of people think that the whole food plant-based health movement began when Forks Over Knives came out in 2011. But we were at this game a long time before that, and these fundamental principles really have not changed. And I'm just so proud of the heritage and the legacy that the NHA continues to hold.
The party a little bit later in your life, was there some provocation for that? Was there something that changed in your life that brought you into that fold, so to speak?
There was some provocation. His name was Mark Huberman.
A big provocation. I know him alone. He's a big provocation. Yes, I get that.
I grew up on a tobacco farm in the South and knew nothing about vegetarianism, veganism, certainly nothing about whole food, plant-based living. And so, of course, one of the first places Mark takes me is to the TrueNorth Health Center. And I spent time there, and it was an awakening. And fortunately, it just made so much sense. I had a 5-year-old when I met Mark that was scheduled for her tonsils and adenoids, stuff that I just thought all children had to go through. I learned some changes with this lifestyle. And when I took her back for her pre-op appointment, the doctor was so angry at the nurse for bringing the wrong patient records. And when he realized those were the right patient records, he was angry at me then to just go home. She didn't need surgery. And so that was plenty of revelation for me to raise my child and for me to make those healthy changes as well.
Alan, you and I know that both of us have pretty much spent most of our adult lives, even most of our professional life, kind of committed and connected to the National Health Association. So let me ask you a question too, because it's one that I ask myself too. What has fueled your passion and commitment to this organization through all of that time? Keep coming back, lecturing, supporting the organization. What's that drive for you?
There's a number of things. Number one, it's the place where the doctors that had the most experience using fasting and a whole plant food diet hung out. That was the place that advocated the use of medically supervised water-only fasting. Even to this day, really the NHA has been the primary mover behind encouraging doctors to pursue the use of water-only fasting in helping people overcome health. And they've been the longest champion of this idea of eating a whole plant food diet. And so for me, getting access to the doctors that had the experience was really a key issue. And also it gave us a platform in order to share these ideas with sympathetic people. Most of the time when we're speaking in the public, there's, skepticism or frank antagonism to these concepts. They're oftentimes vehemently denied or resisted. But at the NHA, it was always like going home because everybody was comfortable and familiar with this idea that it took, radical changes to make radical effects. And so the idea of supporting these ideas was, I think continues to be really the main focal point of the work that we're really trying to do.
Yeah, and I love the fact always that it had really nothing to sell. It was just really selling people on their own autonomy, their ability to heal and be well without selling products and getting lost in a lot of agendas that many organizations get involved in. As we look at the pillars of lifestyle change and lifestyle medicine or even old hygienic care, we know about the biological factors related to food and activity and so on. But one of the things that's come out very strongly in long-lived communities is the sense of community support and connection, that ability of people to come together and find support, and as much a powerful tool in the process of health and recovery as many other things. And the NHA has been kind of on the forefront of that with its issues related to the conferences that you've done. And also now you've morphed into this idea of also altering global travel with healthy transitions to trips and things of that nature. So address that idea that early on in this dance, you guys were turned on to that sense of community as a very powerful factor. And it drove a lot of the beautiful programs, and we're going to segue into the new one that's coming out. But talk a little bit about how that mentality was still fueled way back when a lot of people weren't really doing that.
I would say one thing is that I've often said that if you lead this lifestyle, if you lead a natural hygiene, what we always called the natural hygiene lifestyle, which is now the whole plant food diet lifestyle, is it can be a very lonely operation. You don't get invited out to dinner a lot. You don't invite a lot of people over for dinner a lot. A lot of friends don't understand what you're doing. There aren't a lot of restaurants that you can go comfortably at. So one of the things about the NHA, it was always a place, certainly at the annual conference, where like-minded people could come and share the joy of that lifestyle. My father used to say, kind of recharges your battery. It was a great gathering, and it's still that way. It's why we still sell out at our conferences of 300, 350 people come together every year for that reason. So I think that's a big part of it. That is that sense of community. And I also know that, and as I'm sure all of us that have been in this lifestyle, Lisa and Alan and Frank, that it's also sometimes a very lonely thing, even within families. A husband may be following this lifestyle and the wife doesn't. The kids may not. The relatives don't. It can be really tough. So again, that's that mutual support and sense of community that I think the NHA has uniquely offered for such a very long time. And now, and Wanda can talk more about, the next level, what we've done with travel to make this an opportunity. If you've traveled the world, like if you've traveled anywhere, even in the United States, it can be a challenge. You got to find the Whole Foods, you got to find a restaurant, you got to make arrangements, you have to schlep food with you. We've done something pretty magical. Wanda has done something pretty magical about that. And Wanda, you could talk about that.
Well, for about, we started in about 2017, and it was really listening to what our members wanted. And many of the members wanted to be able to travel. They were true blue to this lifestyle. Many of them had recovered from serious health issues. And we happened to have had a travel agent at one of my conferences. And she actually was her vision. She and Lisa McCarroll is the NHA member and travel advisor. And she approached me and said she never told anybody she was plant-based because she never wanted to do plant-based travel. And she saw how we worked with the chefs at our conferences and how wonderful the meals were for 300 people over 4 days. And she said, will you try an experiment? I'll approach a cruise line and let's see how this works. And the first one was mediocre, quite frankly, and I wasn't sure I wanted to do it. And then we tried another one and it just kept getting better and better to the point that now we have cruise lines. It's become a niche and our people want it. People that aren't even part of NHA want it. And so I have about 5 cruise lines I'm working with, and not only cruise lines, we're doing land travel and it's small groups. And it is back to the lifestyle pillar of wanting connection and community. So you can travel. You're not really getting lectures. Maybe if we have a C day, a doctor will be on board and he or she can give a presentation. But it's really about living life. And it's not about always focusing on food because our lives are so much more than food.
You know, I want to add something here too, that, there's been over 500 people have now traveled with us and are scheduled to travel with us over the next 2 years. And the intersection for probably 80% of those people is TrueNorth. They've been to TrueNorth. That's why there's plenty of vegan travel opportunities out there, but there aren't vegan SOS, whole food, plant-based SOS. That's the real niche that we have. And that intersection is TrueNorth. And that's why kind of leading us into what we here really want to talk about, this new community membership we've developed with TrueNorth, because the alignment of TrueNorth with the NHA has been almost total from the time that it was formed, just as it was with Dr. Scott and Dr. Shelton and those places before, but never so much as it is today. And that's why I think this is such a natural extension relationship between the NHA.
Let's segue into that. Let's segue into that because, having run centers as I have for all these years, and Alan and other people have, when we see these incredible results that happen in our retreats and our centers and so on, one of the holes often was, how do you create and support that success at home? So the idea of having take-home program or a program where people can identify and align and connect with what they've learned, what they've been doing, away from the centers themselves, was real exciting to see that you were embarking on that connection. So as you merge these communities, the TrueNorth community with the NHA community, and you're kind of filling that niche and that gap, give us a little rundown of how you see the program operate. Yeah, so just give me a little rundown on what and how you see the mechanics of this program, what it offers. And Lisa, you can get involved in this too, because I know you're involved in the educational initiative of this whole process. So let's talk about the program, the merging, this kind of collaboration of the two communities, and what the program is about and how it's trying to organize a focus group away at home for these people that can participate.
Yeah, one of the things that we found early on was that people at the center did great. And when they went home, some people struggled for all the reasons that we've already discussed. And that we wanted to figure out, how could we provide people at home more encouragement and support, both. And when we started discussing this idea that the NHA had developed some great skills at providing that kind of continuity and support, we figured it was certainly natural for us to come together and try to figure out how could our patients get the support that the NHA traditionally offered, both in terms of travel, in terms of ongoing support, and how could we provide ongoing educational input for the NHA in terms of providing, structured guidance. Because what happens sometimes is that support groups can be diverted from the primary attention with a lot of the peripheral noise that inherently gets involved in any kind of social setting. So we wanted to provide a little bit of support and structure and guidance, but at the same time create an environment that's not lecture, didactic type of environment, but one which is more, people sharing with each other. And that's why we're really excited when Dr. Acocella agreed to help participate, because this happens to be an area she can walk both sides. She understands all the technical and the doctor stuff, but she also has actually a personality that she cares about people and stuff, which is kind of novel, and is willing to share that and help provide kind of a supportive environment where everybody can be successful in that regards.
Lisa, talk to me about how you see that implemented. What are the actual things you see and feel are essential to manifesting what Alan is talking about?
Well, I think that first and foremost, it is the belief that you're not alone. Because when people come to TrueNorth, or when people find their way to the National Health Association and are connected to others, either at a conference or through a stay at TrueNorth, they are feeling very empowered by the connections that they make. And even with the promise to stay in touch, life happens. And so this platform that has been created gives that opportunity for, whether it's daily or weekly or only for a scheduled event, to have a way to drop in and to remember what's important. And I think another part of this that is really great is being able to also find through this platform people that might be near them, so that they can have in-person experiences that are, just enabling community to grow. I feel like another piece of this that's tantamount and has already been mentioned is that there may be other plant-based communities, but they're not SOS-free. And I've become aware of late of this leniency, this, I call it a false belief that it's all right. It's all right to have a little sugar, have a little salt, or have a little oil. And especially for the people that come to TrueNorth, the pleasure trap is real. And I feel like it's important that there's a place that holds firm, that holds space to health comes from healthy living. I mean, I found the National Health Association in 1992, and by joining this organization and by, having 3 well-timed fasts, I fully recovered my health in my early 30s that I didn't have for the time leading up to that. So where most people have these challenges late in life, for me to have them from birth through all of my young adulthood, I just feel like I'm a really good person to support and educate, holding firm and not believing misinformation about why a little or some is okay.
I was going to say that, it's an interesting observation of mine that in the last month or two, it's almost like the dam is broken on things that there was just everybody sort of agreed that oil, 90% agreed, no oil. And then salt, should be limited. There was McDougall out there. A little bit of salt was okay. You need a little bit of salt. And sugar was okay. Well, maybe a little bit of this. But now it seems like the dam is broken. Now, hey, you know what? Hey, listen, as long as you're eating plants, you're okay. And it is the pleasure trap all over again. And I think it just drives home about the fact that the NHA has upheld a standard that's been the standard unbreakable principles that we've had since our founding. Nobody talked about SOS in the NHA until Alan kind of coined the term maybe 20 years ago. But there was no SOS because salt, oil, and sugar weren't whole foods. They were never part of the NHA. And so I agree with you, Lisa. I think that is something that really does not just distinguishes our travel, but distinguishes our community. That's a really good thing. It's what we're trying to do here.
Well, that's the voice of addiction screaming. We know that. So people want to come back and hold on to things that they found, harder to give up when you want to focus on this community a certain way. But let me ask you a different question and play a different kind of devil's advocate. As you create this group and this program, you're going to have people at all stages of development entering potentially this program. So some will already be really far along on that dance. Some will be just starting. Is there a place for incrementalism within the context of this program? And how do you see that being implemented when you're trying to hold the line for really SOS free and all of that?
I think, there was someone just recently that came to TrueNorth and she's like, my fast has been great. And I know that I can't do this. And so again, it's just like breaking it down. And so one of the things is realizing that creative solutions exist and can emerge. And like with her, what we found was she could commit to an SOS free breakfast. Like, so they're doing that 7 days a week. She's 33.33% there. She's already there. And just her having that reframe, having that mindset shift that she wasn't failing, that she was 33% there, and that then she could go to 50% by having big salads with beans 3 days a week, right? And then she's at 50%. And so again, there is a way that if you can just have a platform to support and educate. And so this isn't about exclusion, but it's also not about saying that something's all right. Like, let's have steps and let's have a path. And also looking at other factors besides the food, and how they tie in. I mean,
Well, that was my only concern, that people weren't there yet. You've really been clear on the idea that you've got a way to bring them into the fold, giving them an opportunity to make those changes. Because if it gets too hardcore right out of the block, we know what the best direction is. The question is, you don't want to turn somebody off because they're not there yet, when you want to allow them an opportunity to get there.
It's important to recognize there's a transition that everybody goes through, but it's also important to know what the direction is. That's why we call TrueNorth. Just because something's difficult doesn't mean it's not correct. And just because somebody's not perfect doesn't mean they don't get a good result. And so the point is, people need to do well enough within their own environment that they can be getting healthier faster than they're getting old and sick.
Right.
So they win.
It
doesn't matter how long it takes them.
Yeah, just because it's difficult doesn't mean it's not doable.
But it's also, I think, the way Wanda and I look at the NHA and NHA travel is that we know that 60% of the people that come on these trips are not SOS free. But we set a standard. We always keep our eye on the prize, and we're here to demonstrate that you can enjoy this lifestyle. You can do it. And I think my own opinion is, I've not done a study to confirm it, but I think that 70% of the people that intersect with TrueNorth that come on our travel come because they know this is what they want to be. This is where they want to be. We've always set the standard out there. We've never done it by way of exclusion, though. We know you're right, everybody's on the path, but we're here to show that you can achieve great health and you can set that standard out there.
There's a difference between giving people just what they want and what they actually need.
Right.
And when eventually what they want becomes what they need, they succeed.
Lisa, let me ask you a question, though, to get a little bit more pointed. Can you just give us a couple of bullet points of what actually will be offered so people have a clear sense, a little clearer sense of what the program and the initiative is about?
Well, I know from the TrueNorth perspective, it's going to be some tangibles. Like, one of the things is when you've been doing this a long time, you forget that when someone leaves, they might need steps around how to appropriately set up their kitchen, how to appropriately think about grocery shopping, just even the concepts of batch cooking. So they're not having the belief that this takes a lot of time. And these are some things that have come to my consciousness just recently, and hearing how the patients are worried about what they're worried about upon their return home. And so it's just normalizing and encouraging. And then also just giving bite-sized tips about how to manage. Dr. Sabatino, your lectures trained me on how to manage a menu at a restaurant. And that's one of my favorite talks that I do, is like how to go in and wield your way through a menu, right? Just the concept that you can read and make a delicious meal off salad and sides. That's, beautiful. And, so just things like this, like driving these concepts home, that you can be empowered to think outside the box and get your needs met and have successes and wins like Atomic Habits talks about, and continue to build your ownership of a new lifestyle that's fully health promoting.
The other thing that I think TrueNorth is excited about as well is that, they have an extraordinary array of doctors that lecture weekly, that put all of this content out there. And we're really excited to share that with our members. Let them understand, let them hear from some of these incredibly charismatic, bright, thoughtful people. And that we'll have access to those, our members of the NHA community will have access to what people get when they're at TrueNorth. They'll be able to get it all through their membership in the NHA. They'll be able to get that in addition to, the podcast that Frank does and all the other resources of the NHA. And of course, Health Science Magazine, that people get this advertising pre-publication that all the TrueNorth people will get to have the benefit.
I really like the idea that the program was set up for the docs to give short little presentations with Q&A and a lot of feedback. And that's always a cool thing, because a lot of times you get docs that are just talking heads and there's people outside just listening. But in this case, you can present some material, really have it interactive, and really address the concerns that people have as in real time to what you're actually teaching and talking
So the mechanics of this are, we've created this new partnership with the TrueNorth Health Foundation. For $15 a month, you get access to the TrueNorth resources, as well as the podcast that you and other colleagues are going to be doing. Of course, you get Health Science Magazine. People can do that as a new membership tier in the NHA for $15 a month or $150 a year. They get 2 months free, essentially. And we share that revenue with the TrueNorth Foundation, so it's kind of a win-win for both of us. And it's something really exciting. It's, as I mentioned earlier, the alignment between the NHA and TrueNorth is almost indistinguishable. And it is the same health education. It's the same health program. We've uniquely championed it for probably twice the life of TrueNorth. But TrueNorth has been around a long time. Well, this is really pretty exciting. People can go to healthscience.org, click on our membership, and join the community for $15 a month or $150 a year, or they can call us, they can email us, and we can give more information on.
I want to jump in, if I could, to add to what the doctor's talking. We're going to have the standard Zoom that everybody's comfortable with, and somebody could be monitoring it. And so we're going to be answering questions. It really is the community, not a lecture series.
That's important, I think, Wanda, because I found that one of the real benefits of TrueNorth is people's interaction with each other. But this dramatically broadens that, because we have tremendous resources within our patient population, people with tremendous skills, experience, and that have actually lived in the real world too, not just those of us that live at TrueNorth and it's relatively easy. And I think their capacity to share with each other their experiences is going to be extremely valuable.
Agreed.
So as we kind of wrap this up, is there any final words that any of you would like to share with the audience out here?
Again, kind of just what I said a minute ago. This has just been a long time coming. I'm really excited. It's a natural fit. I wish it had happened 10 years ago, but we're here now. And I think the sky is the limit in terms of the education that the NHA is going to be able to offer, and that TrueNorth patients will be able to get through the NHA. I think it's just a perfect marriage, and I'm really excited about it.
I think my last comment is just with podcasts that Dr. Goldhamer has done in the last couple of years, and people finding TrueNorth through that avenue, getting this introduction to the NHA, because one of the things that I appreciate is the history of the NHA and what it avails with its membership. And I just feel, that it's a tremendous opportunity for people to understand that a whole plant foods SOS-free lifestyle truly did exist long before the China study was published or Forks Over Knives came out.
Likewise, I'd like to add, I'm really proud of our travel and some of the other things. I'd love to see more people register for the conference before it's sold out. But I love the idea for $15 a month. You can still have community. We certainly recognize not everybody's going to have the opportunity to travel. That's a small segment in reality of what we're doing. So to be able to expand and give you the quarterly hard copy magazine that comes to your house and the newsletter that you'll get and the podcast, the resources, the NHA website itself is a virtual library that if you started today, I don't care if you're 20 or 50, you could never read all of it. It's extensive. And then to have this community activity with so much variable information. At $15 a month, I don't know why you wouldn't try it if you're looking for the least bit of help in this lifestyle.
Anybody else?
I was just going to say, we were talking about our relationship. I think Alan has not missed an NHA conference other than last year for his wife's special birthday. She hauled him off to the North Pole or something. The same thing with you, Frank. I mean, I don't think you've missed an NHA conference in 30, 40 years. That's how connected we are. And, Wanda's been to TrueNorth several times. Alan and I go back so far, it's ridiculous. But it's just a natural fit. I'm really excited for this whole new era of growth for both the NHA and for all the members of the NHA to learn about the world-class care that TrueNorth offers. Because I don't care how you may eat the best SOS-free diet in the world and exercise and rest and all that, we all are going to need TrueNorth at one time or another. And the more you know about it, the more comfortable you are. That's going to be another tool and member benefit of the NHA to have access to become familiar with that availability of TrueNorth. So I'm really excited for that too.
Well, I can't thank my guests enough for being with us today. And I urge you to take advantage of this incredible initiative. We urge you to go to healthscience.org. It'll be the best thing you've ever done to really give you that home support and connection and a community sense that will help you be much more successful as you take this incredible information home. And I want to thank you for being with us, and I look forward to being with you on the next episode of the NHA podcast. Thank you so much.